This is going to blow your mind if you've been diagnosed with a hypothyroid or low thyroid, because the number one cause, I'm talking 90% of people that have been diagnosed with low thyroid, it's this one cause, is hardly ever checked. I mean hardly ever. Now, before I get into that, let me ask you this question. Do you know why your thyroid isn't working? Did your doctor explain to you, this is why your thyroid isn't working, and this is why we need to give you the medication? Or did they just give you, these lab tests are out of range, here's the thyroid medication? That's probably what happened. I've helped people for 20 years and thousands of patients, and this is typically the answer they give me. The number one cause of low thyroid is going to be Hashimoto's disease. And these people, their immune systems are attacking the thyroid gland. So they don't have a thyroid problem, they have a thyroid victim. So let's not blame the victim, let's get to the root cause of the problem. So why don't doctors check for it? Because they don't have a treatment for it, that's why. The standard of care for thyroid treatment in the United States is thyroid hormone replacement therapy, and that's it. That's all you're going to get out of traditional medicine. So if you're taking thyroid medication and your symptoms did not go away, there's still something wrong, and Hashimoto's is probably part of the problem. How do you treat for it? Well, you can't cure it, you manage it. And it is complex, and that's why we help people go through this with them. But here's some big things that you can do when you have Hashimoto's. You have to manage the triggers that is triggering the immune system to want to attack. Some of the big triggers are going to be, number one, food sensitivities. So if you're eating some foods that you start to bloat and you're gassy and you start having to run to the bathroom, that's your GI tract saying, listen, I don't like what I'm getting exposed to. Next one's going to be toxicities. You need to check for those. Maybe you've got mold. Maybe you're getting exposed to something. It could be the foods you're eating. Maybe it's a buildup of some of the pesticides and some of the preservatives we're getting in our food all the time. Nutritional deficiencies, you need to check for that. But you also need to check for imbalanced hormones, maybe anemias, and then you have to remove those things, and then your life will be better.